In May 1898, the city of Calcutta was gripped by panic as an outbreak of bubonic plague spread through densely populated neighborhoods. Fear spread faster than the disease. Families burned bedding in alleyways, neighborhoods were quarantined by British authorities, and rumors of mass eviction circulated. Amid this atmosphere of dread, Swami Vivekananda, already weakened by illness, responded from Belur Math with one of the most remarkable examples of spiritually motivated public service in modern Indian history. Recognizing the twin threats of disease and misinformation, Swami Vivekananda composed a public appeal later known as the Plague Manifesto. Written in Bengali and Hindi and printed at the Udborhan Press, it was distributed widely across the city by volunteers. The manifesto provided both practical medical advice, such as boiling drinking water, cleaning latrines, and avoiding stagnant drainage, as well as moral exhortations to act with compassion and courage. It implored readers not to shun the sick and reminded them that serving those in need was the highest form of worship. And Sister Nivedita, one of Vivekananda's closest disciples, played a key organizational role. Under her leadership, student volunteers were trained to carry out sanitation work in plague-affected areas. Their tasks included cleaning streets, disinfecting homes with carbolic acid and lime, whitewashing walls, and demonstrating hygiene practices to the public. Despite resistance from some sections of society, the volunteers worked tirelessly in areas such as Shampakur, which had seen the highest concentration of cases. And the Ramakrishna Mission's response was swift, practical, and inclusive. Temporary clinics were established to treat plague victims. Volunteers distributed quinine, fennel, rice, and clean water in affected neighborhoods. Historical records show that the mission relied entirely on public donations and a network of local supporters. Letters written by Sister Nivedita during this period document the severe shortages of basic supplies, but also the determination of the relief teams to continue their work despite these challenges. And Chenon, there is no verifiable account of Swami Vivekananda physically lifting plague victims, but his active oversight of the initiative is well documented. While he did not personally enter the worst affected slums due to his health, his guidance shaped every part of the relief effort. In a letter written around this time, he described service to the poor and suffering as equal to the highest form of religious practice from the Indian Medical Gazette. The wards in which the Ramakrishna Mission was active showed lower mortality than neighboring areas without organized intervention. Local journalists praised the work of the mission. One noted that while colonial notices bred fear, the monks of the Ramakrishna order bred hope. The relief work continued until July 1898. After the crisis abated, the Ramakrishna Mission retained a permanent dispensary in North Calcutta, the first free clinic in the city run by a Hindu monastic organization. The work done during the plague deeply influenced the mission's future structure and convinced many followers that public service was not only compatible with spiritual life, but essential to it. And today, original copies of the Plague Manifesto are preserved at the National Library in Calcutta. Scholars regard it as one of India's earliest vernacular public health documents, blending modern sanitation advice with timeless moral conviction. The Ramakrishna Mission's compassionate, science-informed response remains a model for faith-based humanitarianism in times of crisis.